Hi there, welcome back. In today's video, in this tutorial, I just want to share with you essential drug that is Helicobacter pylori kit. So before I dive into the tutorial, I would like now to give brief overview what is a Helicobacter pylori infection. So this is a type of bacteria which infects the lining of your stomach, which can cause sores or inflammation in the lining of the stomach. So what is the causative organism of Helicobacter pylori? So Helicobacter pylori infection is caused by a germ called H. pylori, which can spread through close contact or maybe poor hygiene condition. Okay, what are the risky factors of Helicobacter pylori? So mostly Helicobacter pylori risky factors include direct contact, that is touching someone's saliva or maybe stool or maybe shading their utensils. Number two, or maybe living in a crowded place. For example, if you are living people who have a Helicobacter pylori infection, you can get the disease through by living in the crowded place. Number three, living in developed countries, like maybe and if you are living in a developing countries, you are the risk of getting Helicobacter pylori infection. So what are the symptoms of Helicobacter pylori? So the disease usually doesn't cause any much symptoms, but however, you may feel nausea, vomiting, or maybe bloating, that is abdominal distension, difficulty emptying your bowel, or you may feel unexplained weight loss, or you may feel a burning sensation or maybe a burning pain that is around the upper part of the stomach, that is the epigastrium. You may feel like maybe feeling empty after eating meal. So these are the common symptoms of Helicobacter pylori. So in this video, I just want to share with you the best way in which you can use this combination kit so that you can get rid of any gastric complication. So that is the combination of esomeprazole plus clarithromycin and tinidazole. So esomeprazole is a proton pump inhibitor drug which can block any bacteria or any acid that grows in the stomach. Clarithromycin and tinidazole is an antibiotic which maybe kills the bacteria that grows in the lining of the stomach. So if you're someone who has any gastric complication and you're always running clinic taking and gastric drugs, that is omeprazole, but you're unable to get rid of or recover the disease completely, so this is the basic combination drug in which you can use so that you can recover completely from the disease. So let us have a look at them. So we have oral and we have intravenous administration. So in the oral we have esomeprazole plus clarithromycin and tinidazole. So maybe if you are a patient who is unable to drink or eat anything, your doctor will prescribe for you the intravenous medication, that is metronidazole injection plus esomeprazole 40 mg for IV use. Your doctor will also prescribe for you antibiotic, that is coamoxiclav 1.2 milligram, that is IV use. So this is intravenous administration, and this is oral, in which you can take the pills orally by drinking through your mouth. So how are you going to take the drug? So before you take the drug, make sure that you check the name of the drugs. So this, let us confirm now. You can see there is a esomeprazole which is 40 mg, and we have clarithromycin which is 500 milligram, and we also have tinidazole that is 500 milligram. So how are you going to take the drug? So first, make sure you open the packaging of the drug, and before you take the drug, make sure you check the expiry date of the drug. So you can see, make sure you check the expiry date of the drug. Then what to do, you open the packaging of the drug. So you take only one packaging. Then what you do, you open the packaging, you remove the drug, then this is what you will see inside of the packaging. So this is esomeprazole, this is clarithromycin, and this is tinidazole. So this is how you are going to take the pill. What you do in the morning when you take, so early in the morning, you're supposed to take 1 tab of esomeprazole, that is 40 mg, and 1 tab of clarithromycin, that is 500 milligram. 1 tab of tindazole, that is 500 milligram in the morning. Again, at the night, you can take 1 tab of esomeprazole and 1 tab of clarithromycin and 1 tab of tindazole. That is 1 day. Then what you do, you are supposed to take the drug 14 days. That is the eradication of Helicobacter pylori. So you are supposed to take the drug up to 14 days. That is the eradication of Helicobacter pylori. So you will recover from the disease. Then what you do after 2 months is you can again use the drug, taking the same 14 days. So this is how you are going to take a H. pylori kit. So make sure whenever you are taking the drug, ensure that you avoid the following foods. So you have to avoid spicy foods, and you must also avoid chili peppers. You have to avoid chili peppers. You must also avoid processing foods. Then what you do, make sure you have to take a blend of water. That is, you have to take a blend of water for you to make sure so that you empty your bowel whenever you visit the toilet. So this is how you are going to take Helicobacter pylori kit. So make sure, if you find the video helpful, make sure you subscribe, like and share, and give your comment to this video. Thanks for your watching. See you in the next video.